My name is Dr. Lee Osler. I am in the state of Washington. And so we'll anchor Marty, who is in the other side of the continent in Canada. But we excused Jim and Ann Glenn tonight. They had some computer issues and asked if I wouldn't step in and just host this. So it's the Redox 3 tonight instead of the Redox 5. Maureen is out for another week or two. We'll see her at convention, or those who will be there will see her. But we've got a nice show tonight, a nice program tonight. We've had these two guests on before, talking about kind of some unique applications in both science and cell biology with our friends, the animals. And so Dr. Marty Morin is a veterinarian. He's a research scientist in that arena who has studied extensively what we're talking about tonight. So we'll be excited to hear his take and some of his experiences. And Beth Wofford is in Lexington, Kentucky. That horse that you see over her shoulder is looking in her back window. And hopefully he'll behave as we go forward. But she is, that's iconic for her background, which is horses. She's a horse trainer, and so she has her hands and her livelihood all over those wonderful animals. I remember when I was in Lexington, I was just taken back by all the polished pastures and spaces out there with all those white fences that went on for miles and miles in horse country. Well, we're going to hear from Beth, and she's going to tell us her experiences as a professional on that side and how redox molecules work. We will start this evening with a disclaimer. We are independent associates who are associated with a company called ASEA or ASEA Global. This is a supplement, so it is governed or regulated or ruled over by the FDA rules related to supplements. It's that way here, and it's that way in every country with their equivalent regulatory agencies in their own countries. And as such, we don't make medical claims, we don't cure, we're not treating diseases, and we're not making any claims. And so everything that you hear tonight will be couched in that. We'll be speaking compliantly so that we don't get ourselves or other people into trouble for those reasons. We can make claims for structure and function, and we might maybe want to get into that tonight as to what that might mean. But we are not treating, curing, or diagnosing anything. We're just helping your cells be longer. And I know that Dr. Marty Morin understands that very well. So we have some new people on tonight or who will be watching this recording who will not have known who you are, Dr. Morin. So perhaps in order, we could just go 2 or 3 or 4 minutes with each of you, starting with Dr. Morin. If you could introduce yourself and what is your professional background, what's been your focus, and maybe you could just kind of touch on why are you here? How did this happen that an animal doctor and a research scientist winds up taking a supplement in a blue bottle that has done something for him, or he wouldn't be here. So take it away, Dr. Morin.
Well, thanks, Lee. And we need to give Lee a little breather because this meeting got dumped in his lap at the last minute, and that was a marvelous way to rescue the whole evening. So thank you, Lee.
You're welcome.
But no, my whole active veterinary career was in the research laboratory, working at large research institutions, the National Institutes of Health, Bethesda, Maryland, a couple of large international pharmaceutical companies, and the way they're going, I'll apologize for them. But that's how I got started in my veterinary career, was working in the lab, working with animals and both human and animal research questions. So anyway, it's come full circle now that we're looking at probably the best development for wellness that has ever been available to humans to use. And I was lucky enough to be called by a friend our family was called by good friends, and they were trying something new. It was helping them do better. They wondered if we would watch a video, if we would be interested in learning about it. What our friends didn't know at that time was that I had some serious health challenges. And so the timing was right for me to hear this message. And so a caution to you out there, if you're an ASEA associate, sometimes you reach out to somebody and the timing isn't right for them. Give them a little break and come back to them, a few months later, and maybe the timing will be right. But when the call came to our house, I was ready to hear this message. And basically the only thing Kathy and I, my wife Kathy and I, had to hear was that it was safe. So let's just start right there. This is 100% safe. I can't tell you the name of any veterinary drug that could make that claim. I can't name any human drug that could make that claim. So let's start right there. This is 100% safe. It works 100% of the time. And somebody says, hey, Dr. Morin, I didn't feel it this morning when I drank my Redox molecules. Okay, so what? I promise you, your cells jumped to a higher state of function. And that's the common denominator here. What we're talking about tonight has a function in our cells. And so I'm going to back up a little bit. You are alive right now. Your heart is beating, number one. Number two, I think you're probably breathing oxygen. But after that, redox molecules are critical to your life. Every living cell in your body right now is making redox molecules or it is dying. I think that's critical. So we're talking about being able to supplement back to our bodies something that your cells are making, but probably not as many as you would benefit from having. Quite frankly, teenagers are already deficient in making as many of these molecules as they need. They just haven't figured it out yet. Now you get out to the 70 end of the age spectrum where I am, and you're deficient in something. And as Dr. Lee Osler talks about in his books, I got the chance to wake up my inner doctor, and maybe Lee will tell us that story. But I got the chance to wake up my inner doctor, and I was so surprised that my body had not forgotten how to correct its problems. There was something missing. And my good friends called me and said, maybe you want to learn about this. And hopefully tonight you do. You want to learn about this. Hey, Beth, tell them your story.
Okay. My name is Beth Wofford. I am my husband and I have been training young thoroughbred racehorses on our farm here in Lexington, Kentucky for close to 50 years, I guess. I don't know how that happened, but I was absolutely blessed to have found this technology about 13 years ago. A very dear friend called and said, you need to hear about this, because he was a family practice physician, but he was very holistically minded. And we'd been trading, have you heard about this new technology? Have you heard about this one? Have you heard about this? And when he called me, he said, I think I've heard, this is something I've never have ever imagined would happen in my career. It's the biggest thing that is going to happen to medicine in our lifetime. And it really shocked me, because I'd never heard him say that before. I said, well, I want some right now. I believed him immediately because I trusted him. Because my husband and I, again, my husband's 74, I'm nearing 70. And we want to stay active. We still train racehorses every single day. And we want to stay active as long as we can, because when people ask us, when are we going to retire? We say, and do what? Play with horses? I mean, come on. So I love the idea of staying younger longer. That's how I thought of it. It's just, if these cells, and I heard my friend have almost the same kind of description that Marty just gave us. It just helps your cells work the way they were designed to work years ago. And it's just, they're just going to keep working that, or continue to work that way for a longer period. as soon as I found out that these products were 100% safe, first of all, it turns out that I happened to be the first, because I was so fortunate to find this so early. I was the first professional animal trainer that came on board. And so I was able to be kind of earmarked as the animal person, which I love, because through the last 13 years, I've been compiling animal stories. People call me, we do three-way calls all across the world. We do all of this stuff. And I have an incredible library of animal stories. We did a monthly call for once a month for years and years, and then turned it into a webinar. It is now archived. We were able to archive the webinars. We weren't able to archive the phone calls because we didn't have the sense to do that. We didn't know how to do that, but we now have those webinars archived at animalwebinar.com. And the password is associate with a capital A. So it has been a real pleasure of mine. You cannot hurt yourself with these products, and you cannot hurt your animals. So consequently, especially at the beginning, we were all running around just pouring these molecules down everything we had. I have my horses, my dogs, my cats, everything. And I was hearing these stories. Oh, my ferret is doing great. Oh, my snake is doing great. Oh, I have birds that love this stuff. We had the best stories. But one of the things that Marty and I had decided to talk about tonight is some personal stories that we'd like to say. And it's a little bit of a different take on these molecules. We know, as those of us that are associates and have been associated with ASEA for any length of time, we know that one of the things about this company is these people are the most remarkable people, working with people like you all and the rest of the ASEA family. We are very heart-based. We are here to help other people. And there's nothing in the world that beats that helps other people. You hear all the stories of them. Now they're teaching it in top colleges, the art of happiness. Well, the baseline art of happiness is connection with others and being of service. What we found is, if you're on this call, I would say that possibly you happen to be an animal person. When you enter animals into the mix, and those of us who have had relationships with and heart connections with animals know how special that is. And that adds a whole nother dimension to caring about other living beings on our planet. And we have been so blessed our whole lives to be surrounded by animals. The flip side to that is, most of the time, almost always, we outlive our pet friends. So we are often left with the horrible, unbearable decision of when our pet is suffering enough that we have to make a decision on whether it's their time to go. It's one of the most horrific things that you can do. It's horrible. Those of you who have experienced it know what I'm talking about. But interestingly enough, our wonderful redox molecules have changed that landscape a bit. Now, I'm not going to tell you, I'm not here with this as a disclaimer. This isn't going to make your animals live and live forever. However, what we've found, and what I've heard time and time again, is people will say, I took my wonderful dog to the vet, and he said, it's time. We've been working on this for a while. He's had a problem. It's really time for him to go. And I took him home so that my kids, my family could say goodbye. And we just decided, oh my gosh, it just suddenly occurred to me that if I'm taking these molecules, what the heck? I might as well try to give it to my dog, because it never occurred to me to do that before. But why don't I try giving it to my dog? There's nothing else left. And maybe it'll just make him comfortable for the next few hours. And what happens is, as that little dog's cells begin to awaken, you awaken the inner doctor in that little dog. And that's what these molecules do. When those cells wake up, very, very often, these little animals, they just kind of they revive and they feel better. they feel better for a while. Sometimes I have people call me and say, my dog's running around like a puppy. They said they were going to put him down and he's running around like a puppy. Does that last forever? Of course not. But it gives them a quality of life at the end of their time, sometimes days, sometimes weeks, sometimes months. I've just, one person said a year later, and they die very peacefully by them, in their sleep. And there is no better gift you can give an animal at the end of their life, and any living being at the end of their life. So please keep that in mind. When anyone says I get a lot of horse calls, of course, and they say, I have a very old horse and he's got a lot of joint inflammation and he's not feeling well. Do you think this could help? And I said, of course. I said, your horse is 28 years old. He's really outlived. He's at the very, very end of his life. But I think it would help his quality of life until it's his time to go. And I've heard more and more stories about that. And Marty, I know you have a personal story that just happened recently. Will you share that with us?
Yeah, that's sort of a theme that Beth and I want to talk about tonight. Let me bring up a quick slide. Can we see this?
Sure.
Yeah, we got it.
Nice.
Okay, great. And so this is Maisie. Maisie is our daughter's dog, our grand dog, and she's a standard poodle. And she was injured here at the lake with us over 5 years ago. And the Redox molecules helped her a great deal. And if you want that story, here's that website Beth told you about a little earlier, animalwebinar.com, password is word associate. Go back in the archive. You're going to have to go down a lot of lines to December 18 if you want to hear the story of Maisie and her amazing recovery. Now, the good thing for us when she had that injury is that Maisie drinks Redox molecules every day. And I have to put that now in the past tense because she did pass away a little over a week ago. But as Beth is saying, quality of life was returned. And so I would encourage you to go to that archive and listen to that snippet in that call that had to do with Maisie's recovery, because I'm not going to tell you that story tonight. But Maisie drank molecules every day, and she had a wonderful quality of life. She was with us here at the lake this summer as well, in July, and I watched her. She was doing everything normally. She now has a younger standard poodle in the family who obviously runs a little faster than she does. But at a 12-year age point, Maisie was doing just great. And they were back home in Maryland. The day she passed, my daughter told me she was running around the backyard like normal. In fact, saw a little creature in her backyard and chased after it, nearly caught it. This was a normal day for Maisie, the 5th of September. But my daughter called me that night and said, Maisie laid down and she died.
Oh, sorry.
It was a huge shock to all of us. But as Beth said, it was her time. And so she had 5 additional years. There's a record for you, Beth. 5 additional years. No indications of any kind of long effects from a head injury. Very serious head injury, I might add. And yet she just stopped on the 5th of September. Mm-hmm. And we were very happy to have her in our family.
Marty, that's an interesting story because that talks about the principle of health span. It's like sometimes everybody talks about, well, can I live longer? And it's like, well, if you're really sick the last 10 or 15 years of your life, I don't know that longer is better, but more ideally, we want health span. with my own patients, I talk to them and say, well, we all want to die in our sleep, just not tonight. We want to die younger at a later age. And so that's this concept of health span, that things would go along more normally. That's an incredible story. The idea of humans versus animals in both the research arena, most of the, almost all of the drugs that we're using in the human arena, are trialed or tested or examined close to some kind of an animal model. I don't know if with your research background that you can maybe enlighten us a little bit about that and how this might apply to that. You've done a lot of natural research.
Well, as Dr. Osler says, the drugs that have been developed and brought to the marketplace, at some point, they were extensively safety tested, most of that on the bench. But at some point, it is put into animals just to make sure that it's going to work when they finally get to human clinical trials. And I've participated in some of those drug safety tests, so I understand how the process works. And now, are drugs safety tested? Yes, they are. Does that mean they're safe? No, it doesn't. Because in my biology, they might work really badly, but in your genetics or your biology, they may work fabulously well. I think the other thing that tends to happen with drugs is that we end up on them too long and we may become allergic to them. And then we start having trouble using that same product we've been using for years, but now it doesn't work anymore. But when I do my weekly SIA product presentations, I say, I think the biggest problem is that Dr. 1 puts us on drug 1, Dr. 2, we're now on drug 2, Dr. 3, we're on drug 3. Dr. 1 won't take you off drug 3 because he doesn't know why Dr. 3 put you on it. Nobody's helping us get off these things. Would you like some help? Dr. Osler can tell you the story of the inner doctor. I think you should do that, Lee. But when we wake up our cells to function as well as they possibly can, what I found is that my body needs less supplements. My body needs less pharmaceuticals. In fact, I've gotten off all my pharmaceuticals, and my wife, Kathy, has gotten off or lowered hers. So I'm going to pass it back to you, Dr. Lee. Tell us about this inner doctor and why does this work?
Well, thank you. That is an interesting concept. And the more I've studied this and thought it through, I mean, I can go really deep into subcellular, redox biology, but I'll tell you probably a really simple metaphor or analogy that I think illustrates this. Everybody has, in the room that you're sitting in or the home that you're in, you could probably look around and see a thermostat on the wall. And we all have a thermostat in our homes or our office spaces, even in our cars. And it has a mechanism in it that we set to a predetermined set point that is at, we'll call it balance, it's comfort. It is homeostatic. It's everything's okay, right? But when the ambient condition in the room, the temperature, if it drops below that set point, or if it rises above that set point, something happens in that relay that sends a signal to a box that's sitting somewhere else in your house or your garage or your attic or somewhere that will turn on a process, a machine that will condition, warm, cool, whatever the environment of your house or your room in a way that it returns it to that set point, at which time it turns it off. And so it goes on and off and on and off as the heat or coolness of the conditions, change throughout the day. Now, if there's something wrong with the thermostat, if that relay switch becomes dysfunctional and it doesn't signal properly, or there's a problem with with that box that we call the HVAC or the furnace or whatever, and it's not quite working right. We'll be sitting in this environment and we'll look at each other and we'll say, wow, it's getting kind of cold in here, or really I'm starting to sweat something. And so we'll get up and we'll go get a fan, or we'll get a portable air conditioner, or we'll get a space heater, or we'll get some blankets, or we'll turn the fire on in the fireplace, or do something to change the symptoms of a faulty relay switch or a thermostat. Well, the cell has a thermostat. We don't call it a thermostat. I guess we could call it an oxidostat, an oxidation measurement. This oxidostat measures the thermostat, if you will, in the cell that measures the set point and whether the ambient or environmental conditions are good or bad. And if they're off, if they're out of balance, as the heat of the moment goes up or the coolness of the moment in that analogy happens, if something changes in the environment, then that relay switch such that it turns on a process, and that's the inner doctor. And when that is activated, it then responds to those conditions with a solution that fixes the ambient condition. So now I'm back to my set point. I'm back to balance. I'm back to homeostasis. Well, then 5 hours later, when the heat of the day is going down and it's cooling, it might be cool. Now the stress in the home, we're out of balance again. And so it fixes it again. But the point I'm making is that when I have to bring a space heater, a blanket, a fireplace, a portable air conditioner, a fan, or to spray me down with some water so that I can cool off, that's kind of like having medical intervention. I don't need medical intervention if the cell's working, if the machine is working, if the switch is working, if all the communication is working. I don't need intervention. And even though right now I need a fan, well, I can call a repair person to come fix that mechanism, and then I can put my fan away. So I hope you see the metaphors there, the analogy of that. That is what the inner doctor really is about.
Very good. We're finally back.
Yeah, we finally got on. I don't know what happened to my computer, but it flat out died.
Moment.
We're talking about the quality of life. I think, Marty, you said that. But yet, are animals under stress like we are? The stress that we're under is aging us quicker. It's causing us to put more devices, I guess, Lee, based on what you were saying, more things in our house to help. There's a lot more things going on with us with all the stress. Are the animals under the same kind of, I see Beth nodding her head, but not to the degree that we are they? Or do they feel the tension that we're under? Does that transfer to them?
Well, that's a great question. And I think that's one of the reasons why these molecules seem to work so quickly and so well with our animal friends, is because they don't get in their heads. They don't overthink it. They don't say, oh, wait a minute, this says salt and water on the bottle. This can't be working. They just know, and they relax and they let the molecules do what the molecules do. And their cells start working again and they feel better. The interesting thing is that sometimes you have to coax a dog or a cat to drink a sea at the beginning. And when they start feeling better, they start asking for it, because they know, and they have these pure minds. Now, I will say that our animals feed off us. So when we're very stressed out and we're very upset, they have a tendency to carry that stress as well. So, if you think that you're stressed out and you need these redox molecules, your animal does too, whether it's healthy or not. I mean, I would definitely say our animals would benefit from that. However, I do believe that because they have such a pure psyche, that's the way I kind of look at it, that they really do. That's the reason why you can't placebo an animal. They can't tell themselves that it's not going to work, and they can't tell themselves, oh yes, I know this is going to work. So you can't placebo an animal. So if you have somebody telling you that this can't possibly work because it's salt water, just show them a couple of my animal webinars that we have archived and say, how can it work on an animal? They didn't placebo themselves. So sometimes that works well too.
Now, did you already discuss, Marty, the fact that the ASEA is for human
Consumption.
Are you talking, Marty? You're muted. But the product says that it's for human consumption. There's a fine line there. Can you discuss that, please?
Yeah, I was just going to jump in with that stress level point.
Okay.
If you're stressed, now the ASEA community is about to pack their bags and get on an airplane and go to Texas for the convention next week. I wish we could be there, but we can't be there this year. But take your bags out and put them on the bed, and your dog is stressed. I guarantee it, right? So there's going to be some stress. And in Beth's world, when there's stress in the barn, that's 1,000 pounds or 1,200 pounds dancing sideways. And I'll tell you what, you don't want to be between the animal and the wall when that animal starts dancing sideways. So one of the things Beth has to do is to come up with a way for these animals to be balanced, to be comfortable, so they don't dance sideways. But yes, if we're stressed, our animals pick that up. They will. But back to the question of using this product with animals. Somebody asked a question, just scanned by in the chat, that how much? Well, what I say to people is it's the same as your neighbor. If your neighbor down the street is older, more. If your neighbor down the street is young but ill, more. If your neighbor down the street is young and well, maybe a little less. So because you have a 4-pound cat.
There's one more in there, Marty.
Go ahead.
Young and athletic, or a little bit older and athletic. Because if you have an athletic dog, they may need more, right?
Yeah, that's right. That's right. A lot of animals. Well, I tell you, we're all athletes. If you're not an athlete, and I don't mean in the gym doing some gigantic weightlifting exercise, if you're not moving, I'm sorry, but your body's shutting down and you're in trouble. You just haven't figured it out yet. So you must be moving. Your animal must be moving in order for the body to work properly. It's just, I'm sorry, but it's a part of it. If you're not moving, you're in trouble. So that's the athlete to me, Jim. Taking the dog for a walk is my kind of exercise. I'm not going to go do some marathon run. It wouldn't work for me. But so yeah, the amount of product, I say to people at nearly, I'm what, 75, 76. At my age, I'm going to use a lot more ASEA because I just can't make it to the amount that I want at my age. So I'm going to drink more. And so a young, perfectly healthy horse in Beth's barn probably needs less than I do because of my choice to ramp up, to fill up the tank of my redox molecules to an acceptable level for me. And Kathy and I are up at the lake. We do a lot of physical activity. I was on the boat most of the afternoon today. If I don't have enough of these molecules, I'm having a nap instead of being on the boat. So if you want to be active, if you want to have a high quality of life like we were talking about earlier, then you have to find the level of these molecules that works best for you. And I don't want to hear that a 3-pound cat needs less. It's not the case. A sick cat could use a whole bunch of redox. A well horse, less than Marty. Go wrap your head around that. This is not about your weight. This is about your cells. Horses just have bigger cells. Cats have smaller cells, but we have about the same amount.
Real quick. People, we've been on the molecules. I'm sure we all have been on the molecules, and yet we still have something, we get sick. What would you say in that case?
Drink more.
Okay, just want to make sure, like how much are you drinking? And then if you're feeling puny and, a little bit of that, if it starts tasting like icky pool water again, that means you're not in homeostasis. If it's like icky pool water, then drink more. Any idea how much? Double it, or what would you say maybe?
Well,
Until
I'll
you
tell
feel
you
better.
that on every day, I have 8 ounces. I probably get up and have 8 ounces right at the beginning of my day. And often, like today, I knew I was going to be up a little later than normal for me. I probably had another 8. So there are days I drink half a bottle. And there are days where I will have 8 and my day goes crazy and I don't even get back to drinking anymore during the rest of the day. But a minimum for me is 8.
Beth, what about you? How much do you drink a day?
I drink 8 ounces. Both Bill and I drink 8 ounces every single day without fail, 4 ounces in the morning and 4 ounces at night. Having said that, when I'm, it looks like the virus is kind of coming into play again, where I'm going to get on a plane in 5 or 6 days. I'm going to be around a lot of wonderful people, but a lot of people, and I'm going to double that. So I will be drinking at least 16 ounces while I travel. I usually do that while I travel. We're getting a lot of questions in the chat. I just keep popping up real briefly on how to administer these or how to get animals to drink this. So would you like me to address that real quickly? Okay, great. The first and foremost, dogs are so wonderful and they're so kind and they try so hard to please us. There are a lot of dogs that'll drink up a SIA just like that. They'll just drink it right out of a bowl. You cannot mix it with anything. That's really important. You can't mix it with something that really put it in their water bowl. I've heard people say, "Oh yeah, I put a little ASEA in my dog's water, and then by the end of the day, it'll be gone." You can't do that because then the molecules neutralize before they can get in the body. What we have found, I have a 14-year-old dog who's a farm dog, and he runs 5 or 6 miles every day, running, chasing squirrels, running all over the place. He is very healthy. When we go out of town, the one time we went out of town and I did not tell the farm sitter to give him his ASEA because I thought, we're only going to be gone for like 3 days. And it's, you give him this and make sure he drinks this before he eats that. And I just figured, he can skip it for 3 days. And he went lame in the 3. She called me and she said, "I don't know what's wrong. Something's wrong." And I said, I could kick myself. I said, "See that blue bottle on the sink?" And I talked her through it. She gave it to him the next morning. He was perfectly fine. So it's very important not to make sure that continues, especially the older the dog. I think, Marty, you said one of the things that I get asked all the time is how much. I say it's not weight specific. It is, if you're sick or old, you drink more. Use your intuition. I always tell everybody, you know more about your animal than anybody else on the planet. Use your intuition, and he'll tell you. If he wants more, give him more. It's okay, but especially if he's ill. So in order to get either cats or maybe a dog that isn't quite so, is a little bit more finicky, I use a little plastic syringe, and I tuck my cat, I put him up on the counter, I tuck him under my arm, and I support his chin with one hand, and I just squirt the ASEA in with the other side, and he drinks it every single morning. He's doing great. That's fabulous. A lot of people do that with their dogs. The one thing that I know, Marty, you have done a great job educating people that if you have a dog that kind of looks at it, and of course it has a little strange smell, especially to a dog that has 1,000,000 times more receptors in their noses than we do. You can start off by putting a little bit of some kind of food that they like a lot, a little grilled chicken, a little Parmesan cheese, stinky cheese, something that they like that is really good, and they'll drink it right up. That's great. Now, of course, we're not supposed to mix it with anything. We're supposed to wait 10 minutes before or after we eat. So is the food going to be a problem? Ideally, you like to just wean them slowly but surely off the food, and very often that works. I have a very picky rescue dog who's really finicky, and I put a teeny tiny, like the size of your little fingernail of tuna fish in his ASEA every morning. And yeah, he's probably missing a few of those molecules when I do that, but he drinks it up immediately, and it obviously works, because when he doesn't take it, he's hurting. So that always helps very well. Large animals, most definitely, we found out that because these molecules don't have to be metabolized in any way, they literally go through the lining, through the tissue, the lining of the mouth, the lining of the esophagus, the lining of the stomach. They go directly through the tissues. Well, the lining of the rectum is also very receptive and very absorbent. So if you give a large animal, it's very difficult to give a large animal something orally that is all watery, because they're going to spit it out. No matter how long you hold their heads up, they're going to spit it out, spit some of it out. Yes, it will go through the mouth, through the lining of the mouth, if you can hold it up long enough. But it just kills me to see them spit those molecules onto the ground. So we found that you can just inject it into the rectum, just like taking their temperature. It's much easier for horses than it is for the people when you do it, because horses don't care. So if you just inject it into the rectum, those molecules will be immediately absorbed and go directly to where there's an imbalance in the system. And because the body's looking for homeostasis, the way Lee described that was just perfect. So that's hopefully that will help.
All right. Well, before we leave rectum, this is getting dicey now, isn't it? Jim is all tense and tight. He doesn't know what's going to happen next. There are some guys out there that, you know what? Don't forget that if you can get a little enema tube, and you could put a little bit of ASEA in there and squirt it in. If you're having issues, even bowel issues or prostate issues, don't forget what Beth just said. This isn't just for horses. And while I'm on this subject, since Jim is already uncomfortable, we might as well make him more uncomfortable.
I've got a story about that. I got something I'm going to show you.
We could actually have a really good Vertus Norton story too, and make this one of the all-time favorite Redox 5s. But but veterinary medicine, I would say human medicine too, but veterinary medicine is dependent on reproduction. Cells, all living cells in your body would benefit from this. Small molecules going to go right across the blood-brain barrier to help your brain, going to go help your lungs, going to go help your cardiovascular system, your digestive system. Well, what about your reproductive system? I'll tell you what, this is going to help a lot of animals breed better, right? So we have new puppies, new kittens, new foals, new calves. So I'll just leave it on the veterinary side and you have to extrapolate. Tell us your story, Jim.
Well, the guy that got me involved in this, maybe 3-4 months ago, he went to the doctor and his numbers for that issue went up significantly. And so he gave me a call. We called Jerry White. I'm a little bit embarrassed to show it. I have not used it, but this is it. And this is what exactly he puts, right. 4 ounces. He does 4 ounces of ASEA. And he puts some Renew in it, shakes it up, and his issue got radically better really quick. And he's continued, because I believe every man our ages will eventually have an issue with that little thing, that little gland or whatever it's called. But so anyway,
but it's bigger than just the prostate, right? It's bigger than just the prostate. This is about function of all of your organs, right? Do you want your eyes to work better? I hope you do. Do you want your ears to work better? I hope you do. Do you want to taste your food? Every system in your body could function younger. Beth talked about it earlier. Would you like to live younger, longer? I think this is amazing. Kathy and I have used this product for 10 years now. We are younger today than now chronologically older, 10 years, but functionally our cells don't know that. We have younger cells today than we did 10 years ago. Would you like that?
Yeah.
Would you like to learn about this?
Exactly. Well, and we're not talking about living the length of time, but it's the optimal health while we're living, like y'all talked about earlier. It's the best quality of life. So, I mean, if you have an animal or for yourself or your loved one that may not be on it, it can't hurt them. I mean, it's non-toxic. So don't get too wrapped up in the quantity. If you want to try 6 ounces, 8 ounces on your dog, you can't give it too much. Our 12-year-old dog drinks it, very cooperative. It's a routine. When he first tried it, of course, he had to get used to it. Now it's something he wants. He knows exactly when we're doing it. He lays down. Everything is perfect. And he gets it in his eyes by spray bottle and laps the gel right out of our hand. I mean, he just loves it. So again, like you were saying, play with the quantity and experiment what's going to work for you. In the tests that have been done, 8 ounces. It's been in all the tests, whether it was Tarrant Labs or Appalachian State. I mean, we do no less than 8. And as you said, Beth, when we travel next week and the week after we'll be in Utah, we take more, we drink more because we know we're going to be around pollution and toxins and other people. And Jim had asked about, animals. Well, animals get pollution. Animals are around toxins. Animals, I mean, if you go look at some of the foods and the things that are stuck in some of these these generic type dog foods, cat foods, and there are better options even on the foods that are out there for animals. So we want to give them the best redox potential. But as we were attempting on this computer, Jim was having a hard time. I was listening on the phone, and Marty, you were talking about the medications for animals, and again, same with people. They all have side effects. I know somebody who's dopamine, the neurotransmitters aren't working right, so they get suggested by a doctor, do this particular ABC drug. And then you go look up the drug, and the drug is going to bring hallucinations. Well, you can get the same benefits, better benefits, if you would get the signaling from redox signaling. And now the brain can start working. And then that person's legs can start working the way the communication. So here people go and grab a pill that could be fatal. I mean, listen to the commercials on the TV. And they could try redox signaling. We're not claiming cure, diagnose, or treat. We're just saying, like Lee, your book, The Inner Doctor, allow your body to heal itself. Give it enough time, right? You can't expect this, first week, second week. You need to do it 3 months, 6 months. Some issues take 9 months, 12 months. You didn't have the issue, just yesterday. You probably had it for years. So that means you got to take the product long enough to, to let those cells regenerate. So maybe we can talk about expectations for people, like Jim mentioned. Jim doesn't have an issue, but our best friend does. So he's trying to correct. Well, he needs to go longer. But if Jim was to utilize this, he'd be doing it for being proactive, allowing the body to not get to those bad points. So why don't we talk about expectations and when people are just starting maybe today, the first time on the molecules, how do y'all suggest somebody that's brand new? I mean, I know the answer, but how do you suggest for somebody brand new to length of time to start this, to go?
I think one of the things that's important is to know what's the goal. If you're an associate out there and you're starting a new person, what does this person want to try to see, right? So somebody comes to me and maybe both of their knees are giving them a big problem, right? I'm going to start with a gel. Now, that doesn't mean I don't like the drink. The drink is much more powerful because it can go anywhere in the body and start helping all kinds of things come back like the thermostat Dr. Osler was talking about earlier. This is going to help the thermostat get back into balance, get back into the right spot. But it's not going to pay attention to the knee if the person's got a heart problem or a lung problem or a brain problem. The molecules are going to go to the highest priority need in the body. I love that. I'm not putting that down. But if the person that's in front of me wants to know something is happening for his knee, I'm going to have a better chance with the product, the gel, because we can now target the area that they're concerned about. And we just had a member of our team, I heard the story on Thursday. He was just out for a walk, started a conversation with a lady who was upset about some, veins that were kind of sticking out on part of her anatomy she wasn't happy about. And he happened to have some of this, and he told her about it. And lo and behold, that issue just almost wiped away. And, the lady was shocked, right? What the heck just happened to me? And so she got real curious, and she started looking into this and joined this guy's business very, very quickly. Know what the person, it isn't just their expectations for getting to their goal. Know what their goal is. And then start there with a product that gives them, or a combination of products that gives them the best chance to see something quickly so they don't get despair and just give up. I'll say that when I started 10 years ago, I had a bad shoulder, right? I had done physical therapy, all kinds of stuff for this shoulder. And if that had been my goal, it took 5 months. But I had all kinds of things that I was paying attention to that happened much more quickly than the shoulder. So try to help people, just like Ann's talking about. Set the expectations in a place where they don't despair and give up. Oh, that didn't work for me. I'll guarantee you it is 100% safe, and it works every time you put the molecules in your body, either topically with the gel or with the beverage. Every time your cells will jump to a higher state of function.
I want to ask Lee a question. I've heard this in the last couple of days. Lee, if this is so wonderful, if this is doing everything that you guys say, plants, animals, and humans, then why haven't everybody heard about it?
Well, the real answer is because it's new and because it's not being promoted by pharmaceutical industry. Big pharma is how you learn about things. That's how doctors learn about things that are, on the horizon or suggested for their clinical, applications for their patients. And so you haven't heard about it because we're not marketing it on TV. The big pharma is not marketing it on TV, and it is not a drug. And so you have to realize that there are no vested interests in it that would promote it that way. So you're hearing about it because somebody told you about it. That is the marketing model that this company chose. Marty, would you hold that blue bottle up again? If you walked into, let's say, Walmart or Walgreens or CVS, and you saw that on the shelf, I really doubt that anybody would look at that blue bottle and its ingredients that said saline and immediately recognize it as a wonder, I'm going to say drug, but you're in a drugstore, as a compound or a supplement or an agent that would fix everything we've been talking about. You have to explain this to people. You've got to tell them. So it requires a little bit of footwork and a little bit of patience to explain that. But it's in the nature of it's new. When I started a few years ago, there wasn't anything written on it really to speak of. There was a PhD level biochemistry text. There was a few other more moderate things written, but nobody really took it apart and reassembled it in any instructive way. You had to dive into the original literature and connect all those dots for it to make any sense at all.
Yeah, I
So-
think that was just looking in PubMed, which is the National Library of Medicine for basically the whole world. Part of NIH has this big library, and if you go to PubMed, PubMed, PubMed.gov, you can put in redox signaling. Look what happens. It's now 40,000 peer-reviewed science articles talking about how important redox signaling is. Do I want you to read 40,000 articles? Absolutely not. Drive you crazy. But I want you to go back in history a little bit. When they started talking about vitamin C, I think it was Linus Pauling, the world thought he was insane. Vitamins, what? Nobody knew what a vitamin was. And then, fast forward about 30, 40 years, somebody started talking about antioxidants. What the heck is an antioxidant? And why would I want one? Well, folks, we have fast forwarded now, and the conversation for the next 40 years is going to be about redox. You can learn about it now. You can learn about it in 20 years, but you're going to learn about it.
Amen. Beth?
Finish us off.
Yes, I have to just add a little bit something as far as the medical community. And my entire family are biological scientists. So I'm not dissing the medical industry in any way, shape, or form. But when I found this 13 and a half years ago, I called my daughter, who was working on a PhD in cell and molecular biology at Duke University at that time. And I said, hey, what do you know about redox signaling molecules? Well, she knows her mother rides horses for a living. And she said, that is the weirdest question you've ever asked me. And I said, well, what do you know about it? And she said, well, it's cutting edge cell biology. It's what everybody's working on right now. This was, almost 14 years ago. And I said, well, what if they found a way to stabilize the molecules in a solution so that it would stay stabilized until it hit organic material and then it could go to work in your body? And she said, that's what everybody's trying to do. And it's impossible. It hasn't been done. It's too polarized and it reacts immediately and they can't do it. It's impossible. And if somebody done it, I would know about it. And I said, what if they went the food supplement route instead of the FDA? And there was a silence. And she said, are you telling me somebody's saying that you have redox molecules in a bottle? I don't believe that. That's crazy stuff. And I said, she said, you send me some of that stuff. And I said, will you drink it with an open mind? I would love to send it to you. And she said, yes, it can't possibly be redox molecules. So I sent it to her. And she started drinking it. She is a gym rat. She's a very, very type A. She not only got a PhD from Duke in cell and molecular biology, but then she went to vet school. So she's now a small animal research scientist, just very much like Marty. But anyway, she started drinking it, went to the gym regularly. She was very healthy at the time. But she said, I don't know what this, she called me about 3 weeks later and said, I don't know what this stuff is. It can't be redox molecules. But I was doing my regular workout and I always get on the Stairmaster at the end and just kick butt. I just, run as hard as I can on the Stairmaster at the end of my every workout. And the machine cut off. And I thought, dang, the machine's broken. So I must be just because I was almost at the end of my workout, no big deal. And she reported it, came back the next day, got on the same machine. And they said, we couldn't find anything wrong with the machine. So she started paying attention, did the same workout, was going on and said, I didn't even get tired. That is just really weird. I didn't get tired. And I always it kills me by the end of it. And so she said, whatever this stuff is, it can't be redox molecules. But so I've been sending her, studies after study after study on redox molecules, that this really is redox molecules. Yes, she does drink it. And no, she doesn't tell anybody about it because she said, I want to preserve my reputation. And this is exactly what we come up against. And because none of her research scientists are going to believe her. So she knows it's redox molecules. She's going to drink it, but she's not going to say anything. It's very peculiar. So that's just a little bit of a sideline.
Well, I like Beth just said, I've got a bunch of veterinarians on this product, but I'm the only one crazy enough to talk about it.
They just don't want it as a business. They like it as a product, but not as a business.
I'm going to tell you what, guys, we've got our convention coming up next week. Lee, are you going to make an announcement? Okay, I'll say something real quick. I'm an ex-stockbroker. I'm a business guy, and there's something called the bell curve, right? And it's the introduction of a new technology into the marketplace. Guys, if you can imagine, again, the bell curve going like that, we're all the way to the left still. But I'm telling you what, we're ramping up quick. And I believe we're going to be a $1 billion company within the next 2 to 4 years. We will then multiply very rapidly to where the product will be infused because the stuff works. And when it works every time, if you're smart enough to stay on it long enough, because remember, it has to work. It cannot not work, right, Lee? The gravity thing, it has to work. So this is starting to pick up steam. Don't get left behind. If you don't want to do the business, don't. But get on the product, like Marty and Beth were saying. You want that quality of life, whatever time you've got left on this planet, you want your quality of life to be the best. Don't play that Russian roulette game with your life when one day you're standing up and you fall flat on your face, dead, guys. So, but we're coming, and we're in 33 countries. Yes, it's made from salt water from Salt Lake City. Don't let that blow your mind, right? Do the research. Go read what we've done. Do not go to Amazon to buy this product. We sell it only through distributors like us and other people that are on this call. And then also to do proper research. Don't go to Google and look for a silly article that says, oh my God, it's just stupid salt water. Really, you can't patent salt water, but we're coming. And this is going to be taking off so quickly because it works every time. So we are beyond excited. We will not be here. We thought we were going to do a live testimonial in where we're going in Fort Worth, but we can't because we have an event that night. So we will be back the following Friday with Alan Noble, and he will be doing a wrap up of everything that we caught, that we learned at convention. And with that, Dr. Osler's got a special announcement, and I'm not sure, Lee, if it's just for the people that come to convention, or explain.
Yeah, I've had a lot of people ask, as you know, in recent conventions, I've been there with the books that I've authored about Redox and have sold and signed them at a discount. And I'm not going to do that this time just because of it's a lot of work, a lot of effort, and I don't know. But so I decided to do something maybe one step better, and that is to offer a convention special. So just a little shameless plug here. It's a 25% off. And this will be.
Wait a minute. Wait. There's another book there, Lee.
It's new.
There's another book.
Look at that.
Are you kidding me?
So this is another one. This is a medium content book, they call it. This is a journal. It's how you discipline yourself. It's a progress journal. And I've needed a tool for myself to discipline my daily tasks and activities and people to contact and be in connection with my why and my values and my gratitude, and just a place to make some notes. And so this is the idea that progress does matter. It's a Powered Life logo. And so we'll be developing that further with some other things as well. But the point is, starting on Tuesday for a week, there'll be a 25% off special to anybody around the country for either the ebooks or the printed books. And so that's basically the same as you get it there. If you come to the convention and bring your book, I'd be happy to sign it. But that's my announcement. I appreciate everybody who's supported me and encouraged me to write and keep writing. And I love doing that. I love doing the research.
So
Hey, Jim, I have an announcement too, if you have a minute.
Well, real quick, I want to clarify with Lee. Lee, that will also be available to people that do it virtually.
Yes.
Will they be able to have anybody online?
This doesn't.
They don't have to have that form.
Yeah, it doesn't matter whether you attend or whether you watch virtual or if you don't. All you do is go to redoxmatters.com and the prices will be effective. You're not going to see a code or anything. I'll just adjust the prices on the Amazon site so that they'll reflect that amount for anybody anywhere.
Okay, cool.
Yeah.
All right, thank you. Marty.
Tuesday for a week.
Okay, real quick announcement. Let me see if I can get this to some of us get together on Sunday nights and pray for SIA. There's a story back behind how that all got started. But we also pray for convention. And if you want to join us, take a quick picture of this slide. And there's the Zoom number, and that won't require a code to get in and join us. The first general session will be Thursday at 10 o'clock. So we're going to meet virtually at 9:30, 8:30 in Central Time in Texas, but I'm East Coast time, so I do everything in Eastern Time, 9:30 in the morning on Thursday, the 21st. If you want to join us in praying for the success of the convention and the safety of the people that are there.
And we will also be meeting at the convention. For those that are there, we will have a group, and you'll kind of see where we'll be, but we'll be outside the doors. We'll get our seats in the convention. So when the doors open, go get your seat, save your spot, and then come back out, and we'll have a group out on the first day of the convention on Thursday. So we will also, and Marty, you kind of started that. So Beth, I'm sure you'll be there with us doing
But
that.
when we go to the lobby, are we part of Marty's prayer time?
Well, we'll have our own. So Marty will do his virtually. We'll do ours live on site. Right, Marty?
It's up to people. And
Okay.
if you're stuck in between, you're still in the Starbucks line, you can at 9:30 in the morning, or when the convention's about to start, say a little prayer with us. Just join us spiritually and put some protection around this meeting, put some protection around people's travel.
Awesome.
Thank you.
Well, guys,
y'all are awesome.
Thank you again. We will miss you guys next Friday,
Yeah.
but we will again be back the following Friday. So again, we have Alan Noble, we got Scott Aldred the week after, and then we have Ed Weens. And I'm really excited about the Ed Weens because he's going to be defending network marketing.
Yeah.
He's going to be defending the history. He's going to be educating you to the nth degree, where you will no longer be embarrassed to say that you're a professional network marketer. So with that, guys, thank you so much. The
Thanks,
recording
everybody.
will be up within about an hour at redoxmatters.com. Again, the books are at redoxmatters.com starting Tuesday at any particular time, early, I'm sure.
For a week.
Come back and join us. Come see us at convention. We'll love seeing
Bye,
you guys.
everybody.
Gonna miss you, Marty.
Bye-bye.
Thank you all.
You're awesome.
See you next